There are certain characteristics that are important for being a CNA, standards that you should try to follow, starting with appearance. And it's important to know that there are dress codes within facilities that you need to be aware of and you need to try to follow. And when we do have clinical, if you're doing clinical with our group, there is a specific dress code that needs to be followed for clinical also. There are reasons why we do certain things within the dress code, and we will kind of get to that in a little bit. But a positive first experience when somebody sees you, you want to make that good first impression. Okay. Some of the things that are important would be like wearing your hair up off your shoulder. Um, it's when you're providing care, you're rolling somebody in the bed, you're giving them a bath, you're cleaning them up at the toilet. You don't want your hair in their face, on their body, in the toilet, whatever. These are all important things. Nails are another one that's really important. Nails should be trim and clean and no polish. And that's because all of that, no fake nails, all of that harbors bacteria. And so those are some important factors. Some facilities require tattoos and piercings to be covered, and some do not. When we go to clinical as a group, that is something that is required. Piercings are important when you think about infection control. Sometimes you have a resident that might reach up and they might get caught into your jewelry. Jewelry should be kept at a minimum because of bacteria and also because of safety, possibly scratching them, things of that nature. So you need to look over proper appearance for a CNA, read about it in your book. We can certainly discuss it more if needed. Work ethic is also very important. CNA should be dependable. They should be trustworthy, enthusiastic, accountable. There's so many things that are important in the work ethic of a CNA. Your attitude when you come into work can set the tone for everybody else that you're working with, for your patients, for your coworkers. So you want to be excited and positive about your job rather than, down-faced and, I'm miserable and I hate being here, because everybody reads that and they pick up on that vibe. You really want to be happy to serve others when you're there. Ethics is another important aspect of being a CNA. Ethics is the knowledge of right and wrong, and there's the standard, and it should govern like your standard of conduct. So, if you know something is wrong, but you do it anyway, then that's considered unethical. So you really need to think about your ethics, and do you have the right ethical standards to be a CNA? Some of the examples that they give is not to accept tips or gifts. If the family member wants to bring a plate of cookies for the whole unit or the nurses or whatever, and it's kept up there, that's fine. But if they bring you specially a specific gift, that shouldn't be accepted. Making sure that you're keeping resident information confidential, because that is an ethical thing to do. We know that we need to protect their rights. And doing assigned tasks. Maybe you don't want to give Mrs. Jones a bath today, and so you think nobody will notice, it's busy, I'll just chart that I gave her a bath and didn't. That's unethical. Sometimes we have to do things we don't want to do, but we still need to do them. So, and then charting something that you haven't done and saying that you did it is definitely an unethical behavior. So those are just a few examples. Some different qualities that make a good CNA would be to be an effective communicator. I didn't do too well there, did I? An effective communicator is somebody who listens and also somebody who speaks clearly. So when you're communicating with somebody, it's a two-way street, right? You have to listen to what they're saying, and you have to speak clearly as to what you're trying to communicate. You need to be able to do this with your residents, with family members, and with your coworkers. Being a team player, maybe your patients are all pretty good, but your coworker is like drowning. Jump in and help when you can. work together. It makes the shift go so much smoother, and everybody benefits from team players. Be positive and professional, because that is just a great way to be, and it rubs off on other people. And you need to be an advocate for the resident. An advocate is when you speak up for someone who can't speak for themselves. And so many times these residents tend to lose their voice. And so you have to be the voice for them. You're going to spend more time with the residents than any other team member of that facility. You will know them better than the nurses will. You will know them better than the doctor. You will know them better than anybody else in that healthcare team. So if you feel like their needs are not being met, if you see a change in their behavior, in their physical needs, their mental needs, their social needs, whatever it is, you need to speak up on their behalf and advocate for them and try to get them the services that they need. It's important to understand the CNA scope of practice. And there is a handout under the handout section called Nevers. So you want to definitely take a look at that. It's important to know that your scope of practice pretty well involves activities of daily living, or ADLs. And activities of daily living are things like dressing, bathing, brushing your teeth, going to the bathroom, walking. So you think about everything you do when you get up in the morning to get ready to go out. Those are all activities of daily living, okay? Vital signs are also a part of your CNA scope of practice. So look that over, know what's in your scope of practice, because if a LPN comes up and says, hey, could you give this Tylenol to Susie when she comes out of the bathroom and lays it on the bedside table, and you do it, then that's practicing outside of your scope of practice, okay? So you want to make sure you know what's in your scope of practice so you don't accidentally do something that's not within your scope of practice. The other thing, so medications are definitely a never. Another thing to keep in mind, depending on where you work, if you work in a hospital setting, that is not governed by IDPH, and everything we're teaching you is very long-term care specific. So some of the CNAs or patient care techs in a hospital may be doing things differently than that a CNA in a nursing home would not be allowed to do, because they're trained and able to do those things. Same with like in a doctor's office. So look at that Nevers handout, know what the legal limits are in that CNA role. That's very important to look that over. Okay, so the nursing, the healthcare worker registry, you can actually Google this and go to it. There's some information in your textbook about it that you can look at. Once you have successfully completed the program, that will be on there. Once you've passed that written state exam, that'll be on there. Any work that the CNA's done in the last 24 months will be on there. So, you know, you can take a look at that if you want. What's important to know, because you will be asked this on a test, what is on the registry. They are not looking at things like you showed up late for work isn't on the registry. Demographic information is on the registry. So your name, address, birth date, social, fingerprint check, things of that nature, that's all on there. If you passed your state exam, if you're involved in any investigations regarding abuse or neglect, that's all going to be on there. Okay, so check that out. Also, as part of keeping up with your certification, you will be required to work 12 hours per year, and or not work 12 hours. You'll be required to maintain continuing education credits of 12 hours per year. And there's a lot of free offerings for that throughout the area.